don't smoke, stay healthy, keep your immune system up.
I had an experience more recently at a hospital here, and it was overly crowded. It kind of made me sad that this is how our people are treated.
I had a neck cancer. I was diagnosed in 2009. I was going to go for, I did go for chemo, and then I was going to go for chemo and radiation, but I had a difficult time with the chemo.
It was literally beds all in the middle of the floors, and people who were literally hurting were laying on the floor, and they couldn't be seen by doctors. And that seems to be a problem.
Chemo, radiation, I had 5 neck dissections. They took everything out of my neck, brought it on. I had radiation 5 times. I had specialized radiation, IMRT, that's external. I had IORT during surgery twice, and I had proton radiation.
I was kind of blindsided because I didn't even think about that could be an issue, and it was overly crowded. It was just, this lady was literally having problems breathing, and they were saying to her like, well, it's not an emergency. She's like, well, I can barely breathe. They're like, but you're not, but you still can breathe. Like, it was like, you're not enough of an emergency for us to help you, but also, I don't know how a doctor even deals with that, considering where do you put them?
I needed a jaw replacement due to the overdose of radiation. They replaced my jaw. I had my teeth taken out prior to that. And that basically caused what they call osteoradial necrosis. They took the bone from my leg, put it in my jaw.
I don't want to go off on a tangent, but that really bothered me. It looked like a third world country inside of the hospital.
What borough was this hospital?
It was in Brooklyn.
What hospital was it?
Brooklyn Medical Center.
So I'm dealing with things, but I'm going to get back into it. That's why I'm coming up here walking. Going to start exercising more and live my life.
We're at a walk for multiple sclerosis, and I'm here supporting my sister-in-law and some other my family members.
You got to take precautions and keep your immune system up, eat healthy, live a good life, healthy life, and hopefully you won't get cancer like me.
Keep calm and walk with the exclusive one.
I've been HIV since '97. I full-blown AIDS since '02. My best, a very good friend of mine died in 1990, the same year Keith Haring died. There was nothing they could do for him then. You know, poor Rock Hudson, you know, he was a homosexual, queer actor. I'm not acting now, but I'm a queer man myself. I prefer the word queer, just gay sounds so gay. No, but Rock Hudson took his queerness and his AIDS to the grave. But somebody knew him. Ronald Reagan knew him. They were in the Screen Actors Guild together. Before, see, when that happened, it was Haitians, it was the gay cancer, and junkies, right? That was the main people who were dying of that. And it was called the gay cancer for a while, like the president called it Chinese virus. But the AIDS, there's similarities, the fear, but this fear is insidious. It's walking down the street. I mean, the only way you get AIDS is, you know, blood and semen, but not tears and sweat. And a lot of goddamn tears.
I hope that our, medical workers can continue to keep up. They've been fighting hard and obviously trying to save as many people as they can. And it sounds like New York and Cuomo done a alright job of handling the crisis. But I do think the federal government should have done a lot better job of, or should, they still can, do a lot better job of coordinating, the distribution of supplies and shit. I don't know why they got Kushner up there making up words and shit.
Since I saw on Twitter where they said that the curve was actually flattened, I think they shouldn't make that announcement. Because New Yorkers, they weren't listening before, they're definitely not going to listen now. So you're going to see more people coming out, and we don't even know what's going to happen. So that has me a little bit scared.
What's the fucking point of doing a bunch of social distancing, and then, we say, all right, it's been X amount of weeks, and the trend line is here, but, we still don't know who's infected, who's not.
Because New Yorkers was just going back on the subway, doing what they did. Because now they're being told that, yeah, we're getting it under control. So that's a little bit scary to me.
Cannabis is my best friend. We fell in love from day one.
So stop smoking that weed thinking that it's okay because it's an herb. Don't let them Jamaicans, all these other cats tell you it's an herb, it's a herbal thing. So once you inhale it, now it's a drug.
As long as you can smoke and like get things done, then by all means, smoke.
It helps me a lot. It helps me eat. It helps me sleep. It helps my migraines. I have had 6 concussions, and the last 2 gave me hemorrhage in the back of my head, and I was under stroke risk.
Oh, everybody smokes. Like, even the people that you don't expect to smoke.
Smoking weed. Smoking weed.
Chilling with your friends. Well, it's the people that become really high and don't do shit with their day. Those are like, that's something that you need to work on.
The amount of CBD in the cannabis actually allows me to live a normal life, not to have headaches.